Hi guys, this is Vincent Njao from Vince Fitness team. We have a new show, we call it the Vince Fitness Podcast, and our aim is to educate, inform, and entertain our clients. This podcast is client-centric. Our aim is to empower and help the clients because we believe there is a huge gap between clients, fitness, and trainers. So we want to clarify for you to know what you need and what you don't need. Basically, is breaking down your goals and making it easier for you as you pursue fitness and health. Welcome to the Vince Fitness Podcast, and today's guest is Lameck. He's a physiotherapist. Lameck, kindly introduce yourself.
Thank you, Mr. Vincent. My name is Lameck Naliali. I'm a physiotherapist, although sometimes I refer to myself as sports physio.
Oh, sports physio.
Because that's my specialization.
Oh, good.
Yeah.
That's the main name, right?
Yes.
Okay. How long have you been a physio?
I have been a physio for almost a decade.
Hey, nice.
9 years, going to 10. Yeah, been practicing as physio. I started as a general physio, then I specialized to sports physio.
Okay.
Yeah.
Why did you choose physiotherapy? Or
Normally I normally say physio chose me. I didn't choose physio. Physio chose me. Because as a child, I had this dream of becoming a medical doctor.
Okay.
And all along, the system, you have to study hard and work towards being a medical doctor. So I had a dream of becoming a medical doctor, putting time in school. Unfortunately, the unfortunate happened. So the cutoff was A- for medical students. Okay. I got a B+.
Okay.
And that's how I was left out.
B+ is quite good. It's not bad.
So being a child from the village, Mzee was tough with education. So he forced me to go do education at Egerton.
Okay, nice.
So I prepared to go to university. Then one day I just asked myself, is this what I really want to do? Will I become a good teacher? Because I tried teaching in the village as a UT teacher. It was good, but not good. So where you are doing it for money, but you're not enjoying it.
You're not enjoying it, true.
So on the process of going to Egerton, I spoke to my older sister, who was by then doing law at University of Nairobi. I told her about my story of not becoming a teacher. So she told me, follow your heart. And I applied KMTC. That's 2011.
Okay.
So at KMTC, I applied. Nursing was my first choice.
Oh, nice.
Clinical medicine second. Physio was the last choice. Out of the three, I got physio. That's what I was called to do. So I know, say physio chose me. It was among the last, but it came the first. Yeah.
It's a calling, eh?
Yeah.
Nice. So basically, let's clarify to our audience what is physiotherapy.
Simple definition is physio is a medical, because it's medical. Medical science where we help to prevent, treat, and rehabilitate injury to bring a person to near normal.
Okay.
That's what I can say in simple language physio is.
Okay.
Yeah.
And when should one consider physio?
As we normally say, physio should become a routine thing. You should just consider physio the way you consider going to the doctor. You have pain, you can pass by a physio. You don't have to go to the doctor to be sent to physio.
Okay.
You can come to physio and then be sent to the doctor.
Oh.
Yeah.
Okay. I have a tendency of doing it quite often, monthly, twice, thrice. Is it recommended?
Yes. For prevention purpose, I'll say monthly is good enough. Because we are just preventing any muscular injuries, bone injuries by doing whatever we do, which I'll explain later.
Okay.
So monthly is good enough. If you have an injury, you might come regularly after assessment.
Okay.
We do assessment, then we give you a treatment plan.
What if you don't have an injury, but maybe you're a let's say you don't work out, and basically you're just a busy person, you don't get time to go to the gym, you don't work out, do you still recommend
for those who have sedentary life, maybe they don't work out because of busy schedules, still physio is recommended for alignment and the relaxation of muscles. So I'll still urge you do it.
Right. And now for athletes, because I know we have athletes and we have recreational, and then we have now
us. Yeah. So for athletes, this like work. For them, physio is mandatory. Yes.
You're talking about weekly now for athletes.
Even some we do after 2 days.
After every 2 days.
Yes. Like I have had the privilege of managing some sports team, national sports team. And
nice. Which? Kenya?
Yeah, Kenya. And even outside the country, I had some opportunities to work with them.
Nice.
So for them, it's a routine thing. We do I remember when I was working, I still do, working for one of the Kenyan footballer, Wanyama. I've been attending to him. I used to do physio for him daily. Daily basis. Yes.
I find it painful.
At first it's painful, but it gets easier. With time, once the body starts relaxing and there is no lactic acid, it gets easier.
Wow.
Yeah.
Good. Which team? Is it a volleyball or football team?
He's a soccer player.
No, I mean the team that you mentioned earlier.
I've worked with the athletes, those who run. I've worked with soccer team, the Kenya team. On occasional opportunities, I've been given some occasions where I have worked with them. I've also worked with individual volleyballers. Yeah.
Good. And I believe there's a huge difference between physio and massage.
Yes.
Guys don't tend to differentiate between the two.
Massage is part of physio. Physio is not part of massage. Can that make sense?
Kindly explain.
Massage is a topic in physio.
It's a topic?
Yes, it's like a topic in physio where physio is wide. Massage is just a simple topic in physio where we use it as to relax the muscle. So we have soft massage, you have deep tissue massage, we have relaxing massage. So it's just part of physio.
Yeah. Even the pressure is different.
Yes.
Good.
Then physio, as I said, is wide. We have different categories. We have clinical physio, where we use electrotherapy and simple word I'll say, maybe you have accident and you get a trauma. That one we will use clinical physiotherapy. We have sports physiotherapy, where we prevent, rehabilitate, and treat.
So sports is for
sports
athletes.
Personnel.
Athletes,
Yes. We have pediatric physio for kids who have congenital issues. Maybe you are born with deformity or defects, spinal bifida, cerebral palsy. We do pediatric physio. We have geriatric for old people. We have it's wide. I can say cardiopulmonary for those who are in ICU. Yeah.
So what are some of the conditions that some of the most common conditions or injuries that you've dealt with in your
back pain and
experience?
neck pain? Back pain and neck pain, especially in this city. Back pain, neck pain.
I've noticed guys living a sedentary lifestyle and guys who are active at the gym both experience the same kind of back pain, and we don't get to understand why.
I don't know that I'll put myself under sedentary or active, because I try to be active and I try to be sedentary too. But one thing I can say, back pain is common, especially for the two. Those sedentary, it normally comes with weight. Someone has extra weight and the posture is bad when seated in the office. Extra weight, posture, lack of mobility, they are not active. So it puts pressure on the back. So it causes back pain. And then those who are active, they also overdo we normally say overuse.
Correct.
You find someone lifting weight in a bad posture, someone pushing himself without a rest. So you find they're also injuring themselves.
Okay.
Yeah.
How severe is it? Because I've had so many back pain related complaints and issues. Or does it depend with the...
Depends with the individual.
Okay.
And also the activity. Because I know I have, even yesterday, I had a client with disc bulge. Today in the morning, I had someone with herniated disc from the gym to me straight. So it's a common thing.
Okay.
Yeah.
But for herniated disc, it doesn't heal immediately. It takes time, eh?
Yeah.
Okay.
It depends on the grade. Grade 1, 2, where there's herniation, but there's also muscle spasm. Okay. That one will take a little bit. Let's say 2 weeks, 3 weeks, you're back. We normally classify that acute back pain. Then there's one that's totally out, where the degenerative changes are occurring. That one takes a while, 6 weeks, 8 weeks.
For someone who's living a sedentary lifestyle and they're experiencing back pain, what will you recommend them to do? And what will you recommend to someone who would like to prevent such?
For sedentary, I normally say mobility is everything. Just start moving.
Okay.
You need to start moving.
May it be walking, stretching,
running. Active. Just be active. Okay. Mobility is everything. It simplifies any treatment that I can give.
Okay.
Just be active and be consistent.
Meaning the major cause is sitting down for long. Not being active. You find someone just like from the car to the office, car, home, bike. The routine just continue. The cycle just continue. Okay.
Yeah. So you need to be active and mobile.
Okay. All the time.
Yes.
You also mentioned about neck pain. What's the cause of neck pain?
Posture.
Yes. Sitting down in a computer.
Sitting down on a computer, phone, watching movies, long hours, typing. Because most of us don't know how to position ourselves. Okay. We normally call it ergometrics. We don't understand that, but we need to improve on it.
What sitting position would you recommend for these people, or for preventive
measures?
measures?
If you have an office job where you have to sit for long hours, at least every 2 hours you need to take a break and walk around and stretch.
Okay.
Or if it's tight, you can't leave the office or you can't walk around, you need to have a standing desk.
Okay.
If not, where you have to be seated, you need to lift your desk or lower your chair until it's on your face level.
Okay.
Yeah.
You've mentioned about stretching for guys who work long hours seated. Maybe you can mention 3 or 2 stretches that they can practice at the office, maybe.
There are simple stretches, like just rotating the shoulders.
Okay.
Just to relax, you try to rotate the shoulders. Yes. Okay. There's also where you stretch the arms. Okay. Just overhead stretches. You hold the arm, stretch.
You squeeze. Okay.
Yes.
Pull it back.
There's pulling the hands forward and move. Then you can also stretch the legs and the back, bending forward, stretching back.
Okay.
Yeah.
I've had there's one common injury that I've had at the gym. I've guys always complaining about a knee pain, and I don't get to understand, because guys are quick to diagnose that it's this and this, it's this and this, but then at the end of the day, if you visit a physio, the knee pain is gone. Kindly address that.
I'll say there's this myth where people tend to believe that you can self-diagnose or you can use Dr. Google. Dr. Google is good because that's the way the technology is coming to take over, yes. But there are some specs where you find it's something very simple, especially the knee. You'll find someone has iliotibial band syndrome. The ITB is the muscle along by the side of from the hip to the knee. It's called ITB, iliotibial band.
Outer thigh?
Yes.
Okay.
So you'll find it sometimes it's tight and it's causing severe knee pain. And then when you just take on Dr. Google, Dr. Google will say, maybe meniscus tear or something. It will find you have misdiagnosis and you are taking some medication or you are doing some other treatment by yourself, which is not working.
Okay.
Yet it's something very simple where you go to a physio, they relax it, you are good enough. There is also tightness of the muscle, where especially something like tendinitis, patellofemoral tendinitis, where the cord is tight and it's putting pressure on the patellar tendon, causing knee pain.
Okay.
So you go to a physio, works on the cord, the pain is gone. But if you go to Dr. Google, he'll tell you ACL tear or something. You find there is inactivity of the vastus medialis, the inner muscle of the thigh. You go to Dr. Google, he'll tell you medial meniscus tear. Yet it's just masculine.
Okay.
So I'll encourage and discourage. I'll encourage self-learning.
Okay.
You need to read and understand your body. But I'll discourage self-diagnosis, where you are using Dr. Google to give your self-diagnosis.
Okay.
Sometimes it doesn't work. Sometimes it works, sometimes it doesn't work. Yeah.
Another common injury that I've had so often is the sciatica.
Yeah.
It's very common. I've had so many people ask so many questions about it. The elderly, the young ones. What are the preventive measures and what is the solution to that?
So for sciatica, I normally say there are two causes. One is where the nerve is impinged. Sciatic nerve is just a nerve from the back running through the back side of the leg, glute, hamstring, to the calf. Knee.
Okay.
Then it divides into two. So I won't go into those details, but the sciatic nerve divides into two.
Okay.
When it reaches the knee level. So it's majorly caused by two causes. One is when there's impingement at the back at L2, L2 L5 level, L4 level. Okay. L2, L3, L3, L4 level. And then there's also impingement at the glute. There's a small muscle called piriformis, which can impinge the sciatic nerve. Okay. So depending on what's the cause of your sciatic pain, if it's just the piriformis, active stretches relieve it.
How long does it take to recover?
Depends on severity.
Okay.
So if it's just impingement, maybe you sat for long, or you sat on the wallet, or you sat on a hard surface and there's impingement by the piriformis, the easiest treatment at home is active stretches, where there's this pigeon pose, there's this figure 4 stretch, there is where you lie on your back and put your legs vertically on the wall. It stretches it out, the pain goes. Okay. If it's impinged at the back, that's where the story starts. You can do self-treatment by doing something called slump test and treatment.
What is that?
Where you sit on a bed or on a high level, a table or bed, and then you flex your leg and then flex the neck. It's a continuous motion. It's a test in physio, and it's also a treatment in physio. You can do that, self-treatment. Okay. Or you have to see a physiotherapist where they'll try to do mobilization and manipulation at the spine to try and open it up.
Okay.
Yeah.
Another one is elbow pain. Is it tennis elbow?
They are both. Tennis elbow and golfer's elbow.
Okay. Which is which?
Tennis elbow, because we play tennis by hitting the racket out. Okay. So tennis elbow is on the lateral side. Okay. Golfer's elbow is on the medial side. So that one's also a common one, especially for weightlifters.
That's what I get most. The one for the inside, right?
Yes. Okay. That's commonly for weightlifters, where you recruit your forearm muscles, and they tend to put pressure on the tendon. Okay. That inserts at the epicondyle there, medial epicondyle. So it gets inflamed. Quick remedy at home. You use the tennis ball itself. Just try to rub on the muscle around, but don't put it on the tendon. Okay. Work on the muscle around. Or see a physiotherapist, as usual.
Okay. Yeah. The other one?
Golfer's elbow, same. Golfer's elbow is the inner one. Tennis elbow is the outer one. So golfer's elbow, you also use tennis ball or golf ball, depending on your ability. Yes. Okay. Just work on the muscle along.
Do you need to add pressure gently?
Gently.
Okay.
So long as you don't touch the tendon. If you touch the tendon, it gets more inflamed.
Okay.
Yeah.
So from what you've said, I can tell that there is two kinds of injuries. One on the muscle and the other one on the tendon.
Yes.
Which one is the most severe?
Tendon one.
Tendon?
Yeah.
Why? I find a hamstring tear to be brutal.
Tendon one because it takes time to heal.
Okay.
Because tendons are poorly vasculated, they don't get enough blood supply, so they take time to heal.
Okay.
Muscle take shorter time to heal. Then ligament take longer.
Oh.
Yes.
Why?
Because they are also poorly circulated and they join bone to bone.
Okay.
Tendon join muscle to bone. Then muscle is just muscle.
Okay.
Yeah.
There's another injury that either footballers, rugby players, the ACL one, the anterior cruciate ligament. Very common. Is the cause of it, is it high speed reflex, or is it weight gain, or is it a hard surface, or is it bad shoe?
For your option that you gave me, because you have already given me answers, I'll pick the first two. High speed reflex.
Okay.
Those sudden movements. Number two, poor landing.
Poor landing, yeah?
Yes.
Okay.
Because the ACL is one of the crucial tendons.
Okay.
Of the crucial ligaments of the knee. It helps to stop the femur to overpass the tibia.
Okay.
It helps to stop that movement. So it's very crucial for you walking. So when you have those sudden breaks or you have those sudden twists and turns, you tend to put pressure on it and it can tear.
Okay.
Yeah.
I have a good number of athletes who really love running, road running. And they do some solid kilometers in a week, 150, 200. And there's a common injury, shin splits. And the other one I think you've addressed, it's a knee and hip maybe. And
the heel, plantar fasciitis.
Yes, on the heel.
Yeah.
Kindly, you can address that.
So, as we know, people have different abilities. There are some who get relief in a long distance running. But what I normally advise when you come to our clinic, ensure you have good attire. Attire, I mean shoes and the clothes that you're putting on.
Okay.
Especially something like shin splints, it comes from the impact. When you're running on a hard surface and you have poor shoes, they don't pad you well, definitely shin splints are coming to knock.
And they're painful.
Yes. And sometimes they are very severe that you can't even sleep.
Okay.
Plantar fasciitis, the sole of the foot aching, also come with poor padding or running on a hard surface with poor shoes. Happen most of the time.
Wow.
So like the likes of Kina Kipchoge, Keino, and those super elites, you'll find them, they have good shoes. They have those shin sleeves where they put and they help them to compact the muscle together. So if you want to run long distance, you have to get good shoes, invest in good shoes, invest in sleeves, and just monitor how you run.
Okay.
Yeah.
What are the some of most severe cases that you've dealt with, and what are they?
Wow.
The one that you've found to be, it's extremely challenging to you, and it's between maybe I won't say paralysis, the client is between a hard place and a rock. They're not sure if they'll be able maybe to walk again, and you restore that hope.
With a decade of experience, I've seen a lot. I've met some conditions that are a bit terrifying. There's this condition called GBS, Guillain-Barré syndrome. Guillain-Barré syndrome, where the body attacks itself. There is an autoimmune disease.
How?
Okay. Your bad cells attack your good cells.
Okay.
And the body starts losing power. You just become paralyzed.
Okay.
I think that is one of the cases I always refer on. I've had a client with GBS. We worked together for 6 months. Fortunately or luckily, he is up and playing basketball.
Fully recovered.
100%. I've had stroke patients.
Okay.
So far, I normally count. I have rehabilitated 25
stroke
patients. Yes. I've failed. Did I fail? No, I won't say I failed, but
you learned.
I learned, and also things happen. Incidents happened. One passed on after we tried treatment, but his blood pressure was not going well. So it was a medical case, emergency, passed on. May he rest in peace. Another one, it was too painful for him. So he refused treatment. So we terminated treatment. Yes.
Okay.
But the 23 ones have been a success. And they are working. Some are very good friends. They still visit till today. And those are years back.
Okay.
They still visit. So it has been a learning experience.
Okay.
We also have common injuries in the clinic. We have back pain where people come, some on wheelchair.
Really?
And they live walking.
They live walking?
Yes. Because maybe it's a disc herniation. You try to fix it back, someone's happy. We have cases of muscle spasm. It's like a common thing in the gym where someone tried to lift something and then the muscle just guard. They come crying and it's very painful.
I used to experience lower back.
Yes.
Back spasm.
Yeah.
Even tying shoelaces was a struggle.
Yes. You work on it and someone leave the clinic happy and satisfied. We have... What else? There are those small injuries. I have rehabilitated the meniscus. Those meniscus tear. And...
How?
The
meniscus tear?
Yes.
Wow, nice.
We normally say...
it's a long process. It's not a one-time thing, eh?
Yeah, it's not a one-time thing. It depends on the grade. Grade 1, 2. That's something you can fix it in a span of 4 weeks to 8 weeks. A month, 2 months, someone is back. Now you start the journey of back to play.
Okay.
We have the ACL tear and after repair. The Achilles repair. Yeah.
Okay. Wow, those are actually some of the best experiences that you've encountered.
Yeah.
Is there anything you'd like to add about physio? Is there a question that I've not asked you about physio you'd like to answer?
The common question. Can I see a physio before seeing a doctor? Yes, you can see a physio before you see a doctor. Physiotherapy is part of medicine.
Okay.
Yeah, most of good physios have gone to school. They are qualified. They'll make judgment, good assessment and good judgment. If something they can handle at the clinic, they'll tell you we can handle this. If something they can't, they'll tell you we can't handle this. We refer you to orthopedic doctor or a neuro doctor. Yes.
I think there's a question I forgot about dislocations. I've seen a knee dislocation where the patella moved on the side, and I've seen shoulder dislocation. Somebody doing pull-ups, then all of a sudden
it pops out.
What is the major cause of dislocation? Is it a weak shoulder or a weak joint? Is it a poor handling of maybe equipment or something?
Whatever you have mentioned is also part of it. But we normally say there's joint laxity, where the ligaments are longer.
Okay.
It can be a source of dislocation. We also have poor mechanism when you're handling maybe your weights or whatever. And then there's those tear where we have just the ligament is torn. Maybe you got into a fall or an accident, you didn't know there's a tear. You go to the gym, you lift weight and it's out.
It pops.
Yeah.
Okay. That's the major cause.
Yes. Ligament laxity and those trauma, tear.
Okay.
Yeah.
So as you mentioned, I can say that you've mentioned stretching in so many places and how important it is, either for sedentary lifestyle or for active lifestyle. Especially we can see for gym people, stretching should be every day after workout.
Yes.
For office people, we've agreed is that after every 2 hours,
You have to
stand
stretch.
up and do something just to be active, right?
Yes.
Those are some of the things that they'll prevent back pain and
Neck pain, that sciatica that we mentioned. Stretching is ideal. We have 2 types of stretches. We have dynamic stretches and static stretch.
Okay.
Dynamic is where you incorporate movement in it. Static is where you do without incorporating movement. So static stretches can be done anywhere. Mention
any 3 static stretches.
You lift up your arm, you hold over the elbow, stretch on the side, just like this, and you hold for 15 seconds. That's a static stretch.
Okay.
Dynamic stretch is now where you have to incorporate movement.
Okay.
Yeah, you swing the movement.
Okay.
Yeah.
Good. So, Lameck, where can our audience find you? Maybe online, physically, and what's your number, your details, contact? Where can they find you? Because we've had so many questions about physiotherapy, pain related issues. Tell us.
We have a clinic on Gong Road at
Gong
Bishop.
Road?
Yes, at Bishop Magwa Center, first floor, room number F12. That's our physical location.
Okay.
Online, we have a Facebook page and we also have an Instagram page, Quality Care Physiotherapy Center.
Okay.
And number, you can contact us directly on 07 00 24 33 45.
Okay.
Yeah.
So general questions. These questions are out of the physiotherapy topic. What are the 3 movies you'd recommend to our audience? 3 movies that you watched and you felt like you felt good, or they inspired you, or you enjoyed? Doesn't have to be a movie, can be a documentary, can be a series, whatever.
I have 2 favorites.
Okay.
There's this movie of 3 Idiots. I know it's a bit childish, but it's one of my favorite movies. I think I have watched it more than 20 times.
Okay.
Just because this guy never gave up on their dream. And it's possible. Whatever you want to do, it's possible. Just don't give up on it.
Okay.
Then there's which one else? Oh, I'm a fan of Black Panther.
Nice.
It's something I've also watched over and over. And which other movie would I recommend? Maybe a TV series.
Okay.
Yeah.
Which one?
Marlin.
Good.
Yeah.
What 3 books you'll recommend to our audience to read?
Wow. I'm a seasonal reader, so I enjoy reading books. And of late, I've been reading more about physio, so I won't say about physio. Let me say general books.
Okay.
Oh, if for physio, there's this Grey's Anatomy.
Grey's Anatomy.
It's a big book, but you tend to understand your body, so you can read it.
Okay.
Let me mention the medical ones. There's this guy, Tone. Physiology is also a very big book, but you enjoy reading it because you tend to know how your body functions.
And explain about muscles and everything.
Yes, you tend to know how your body functions, how whatever is good and what's bad on your body.
Okay.
Then outside the books, the physio books, they are just the common novels that I normally read. I have seen. Would I say I read romantic books in between there?
It's fine.
Or should I name the general ones?
Any. Whichever you prefer.
There is this common African book called The Concubine.
The Concubine,
Yeah. I think I have read the novel 10 times. I even know
nice.
the characters.
Nice one.
I have also read Shreds. So, yeah.
Good. Your last words for our listeners before we finish? Anything you can tell them about physio? Maybe is to change their perspective of maybe injury and rehabilitation?
I think I should have started with this. Today is World Physiotherapy Day.
Oh, nice.
8th of September is always a World Physiotherapy Day. So we celebrate physiotherapists and we celebrate all the magic that we do. Because I normally say physio is a little magician. Because someone coming in pain and they live without pain is a miracle being done. So there's this perception of it's painful. Yes, it's uncomfortable. That's the word I normally use. I know. I think Vincent, I have told you that pain is a perception. Is whatever Vincent felt is not what Lameck will feel.
True.
Is a perception. You just come. Everybody have their own experience. Come, try it out. It works.
Okay.
Yeah, physio works.
Physio works.
Yes.
And you can recommend to everyone. It doesn't have to be.
You don't have to be injured. You don't have to be a super elite or recreational. So long as you want a quality life, you just have to try physio. It restores quality life and good health. Yeah.
Lameck, thank you so much once again for coming, for creating time. I know you're a busy person. You've had to postpone your sessions this afternoon to be with us. Thank you so much for coming. We don't take it for granted. We highly appreciate.
Thank you so much. And for our producer, thank you for welcoming us. It's a privilege to meet you guys. Vincent, I know I have met him several occasions, but for you, it's a privilege. And I think I'll start by welcoming you to be my first client again. So welcome to our clinic.
And to our audience, I hope you've enjoyed this podcast and this series of physiotherapy. Kindly, if you have any questions, post them down on the comment section. Then we can address them maybe in the coming days. Thank you so much.
Asante.
Yeah. This show was recorded and produced at Represented Studio in Nairobi, Kenya.